Another day, and we're talking about more deaths in Victoria, again, most of them in aged care facilities. And I'm going to focus on the pandemic in a couple of interviews tonight. But let's look at a couple of developments that I reckon are pretty important. First, from the Prime Minister on aged care problems, responsibility and solutions. Scott Morrison has rejected assertions at the Royal Commission that there was no COVID-19 plan for aged care. On the contrary, he says there was a plan, it's been in place and it's been continually updated. But he has conceded that at times the aged care sector has fallen short, and he's offered this apology.
Of course we're sorry about that. Of course we're devastated by it. Of course it is something that motivates to try and ensure that those issues don't arise again.
Now, we'll hear a lot more on this. It is difficult and it's an issue of state, federal and private sector overlap, but it's the front line. It hasn't received enough focus and the federal government must lead action to improve protections for aged care facilities because the virus is not going away, as we keep saying. Now, we've been saying on this program since early March that the virus needs to be particularly protected at aged care facilities, and it's enormously frustrating that we still seem to be playing catch-up. When it comes to living with the virus, there was an important exchange today at that major press conference, though. We looked yesterday at how cancer specialists believe more people will die from cancer because of the virus. The pandemic is either preventing or dissuading people from regular checkups and screenings. That story was first reported by John Keogh in the Australian Financial Review. And today he took up those issues, those pandemic-related issues, and how other parts of the response are hurting people in other ways. He took it up directly with the Prime Minister.
My question is our singular, narrow, at times hysterical focus on the virus costing many other unintended consequences, many other lives? Why aren't our health professionals at the federal and state level talking more publicly about this? And could you, in the future, when you do your briefings on the coronavirus cases and deaths, which are very sad, but could you provide a more holistic view on the other consequences of our policy responses as well? The suicides, the mental health issues, the family violence, the cancer deaths, the heart disease deaths, the job losses as well, to give people a full picture of our policy responses to the coronavirus.
Do you want to start with that one, Paul?
It's a rather comprehensive question. Thank you. So firstly, we of course, and have many times, and in fact my colleague Professor Kidd has had, I think, his 50th webinar with GPs, primary care and other health professionals this week. And at each of those, he has stressed the need to not ignore those other things. You're quite correct.
Yeah, it was a great question from John Keogh. A lot for these people to address, the Chief Medical Officer and the Prime Minister. But once the Chief Medical Officer had finished, the Prime Minister tackled it.
I don't accept the hypothesis which says that this has been pursued in the narrow way that is suggested. The Chief Medical Officer is the Chief Medical Officer, not the Chief COVID-19 Officer. And both Paul and Brendan have undertaken their tasks looking to the health of the entire population and the many other challenges that are faced. But we can't pretend that COVID-19 is not there and go on our own merry way on other matters. Of course, we have to manage all of this together. There are so many moving parts in all of this.
There sure are, and the Prime Minister went on to talk about mental health, which is fair enough. That's a very important part of the response. But the reason I think this is important is because this exchange suggests a much-needed shift in the national debate and the national response. We've got to stop talking about this as a daily scorecard of infections and mortality. The response to the pandemic is causing myriad other problems. We have to look at all of those: medical, social, economic, educational and societal. We have to consider it all as we work out what to do next, what level of restrictions we can endure, what level of infections we can tolerate. There was one little example today, another development, with the announcement that Canberra Airport will be shutting down altogether from now on some Saturdays and on some Tuesdays. Our nation's capital, yet so few flights that the airport will not be open every day for the foreseeable future. This is astonishing and sobering for what it says about the economic, political and social slowdown in this country. How long can we keep doing this to ourselves? Unless there is a vaccine, you might get sick of me saying this, I know, but unless there is a vaccine, we have to work out how to live with the virus.